Hi everyone, so I'm currently in the hospital. I've just seen a new rheumatologist who's actually really good and really understanding. So right now I'm waiting for x-ray, as you can see, and now I'm in the wheelchair, which has been really handy because it's been a really long walk. I've got my crutches with me, but to be honest, they're not really that helpful, so the wheelchair has been a lifeline today. So I'm just going to pop into x-ray and I'll let you all know how it goes. Bye. Hi everyone, I've just got back from my hospital appointment and I thought I would give an update as it was really quick what I did before. I was about to go into x-ray. So basically I saw a new rheumatologist today. My GP had referred me to just have a checkup generally to see how my Ehlers-Danlos is going because my symptoms have worsened, and he thinks I may have rheumatoid arthritis as well as osteoarthritis. So I just had a full checkup and they did the Beighton score test on me again, which if you have hypermobility or Ehlers-Danlos, they tend to check nine different things, and it normally bending your baby finger backwards and your thumb down, if you can twist your arms, if you can touch the floor, and they test your elbows and your shoulders and all different things. So I was pulled about like a rag doll today, but it's worth it because he was actually a really good consultant. So I feel quite lucky because I have had some really awful consultations in the past, and I know the doctors are overworked and some of the nurses normally are as well, but today at the Princess Alexandra Hospital, they were just amazing with me and they all wheeled me around when the porters weren't available. So I feel very lucky to have the NHS, and I know that without it, I don't know how I would cope financially, to be honest, because the amount of conditions I have and the different clinics and consultants that I see, I wouldn't be able to do it. So I don't know how people do it in America. I feel for you. And trust me, I do know how lucky I am to have the NHS. It has its flaws, of course. I've had some awful consultants, some awful nurses. I've had some horrible consultations that have made me cry, made me angry, like they've been harsh and dismissive and rude, and like just the way they talk, the demeanor, and I've been made to feel like a fraud. And they have the list of all the conditions that I have in front of them and all of my MRI results, yet sometimes they don't even look at you. So anyway, I think everyone's been through some awful consultations that have left them quite scarred. And I mean, today I did panic a little bit before my appointment. I do suffer with medical PTSD, so that's not spoken about too often. I do want to do a video just on that. And I mean, I got medical PTSD from all of the investigations I've had, all of the tests, the surgeries, and some procedures have gone wrong and it was very traumatic, and it doesn't leave your head, and sometimes I get flashbacks, I get palpitations, I get hot flushes. That's why I'm looking a little bit shiny, and sorry about this is where I was wearing my glasses earlier. Because of the Ehlers-Danlos, I actually get marked, especially if I'm leaning in bed. I'll have marks all over me, and I know that normal people get that, people who don't have a condition, but with Ehlers-Danlos we have really soft skin, so anything can mark us. Let me know below if you suffer from that as well with Ehlers-Danlos, because it's not spoken about often. I do want to speak about medical PTSD a lot more in detail, but this isn't the video. I just thought with this video I will let you know about the rheumatologist. So he checked out my Ehlers-Danlos. We did all of the tests to see how many of the score I have at the moment. So I used to have 7 out of 9, and now I have 6 out of 9 because I've stiffened up with my arthritis. So that's not really good news. I wish it was good news, but it isn't. But there we go. He sent me for an x-ray for my shoulders, my hands, and my feet because they've been dislocating very frequently. Like, my shoulders come out of place every single day. Every morning when I wake up, I have to put them back in place without fail every day. When I walk, my knees dislocate, the patella moves to the side, my ankles click in and out, my finger joints are constantly clicking in and out. I don't know if you can see this, but oh, it doesn't show. Look, I have that bend in my finger from where I'm hypermobile in my fingers. That's not normal. So my fingers have been really bad. They've been swelling up really often. And there's a really bad pain at the bottom of my left foot, which my neurologist thinks that it's just to do with my spinal issues and my neck problems. But the rheumatologist thinks that it's actually my arches are collapsing, and that's a really big symptom that comes along with the elastin loss and the hypermobility, because the joints are so lax from the collagen. So eventually they do go flat. And as a dancer, or as a previous dancer, my arches falling is like, it's a catastrophe. And even though I don't dance anymore, having my high arches was always just something that I loved, and I was always quite happy and proud of them, but they're collapsing. It's not fair. But I mean, I'm overweight as well. I've put on so much weight from lack of movement, from steroids. I'm often put on steroids because of my asthma and just to help me with my pains and my other joint problems. So I'm on and off of steroids very often. But my weight is just, it's gone up and up and up with the Hashimoto's, which is a strong form of underactive thyroid. And the weight is impossible to lose. And because I can't exercise and I'm not very mobile, the weight just won't shift. So if you imagine all that extra weight on your arches when you've got flexible, lax joints, of course the arches are going to collapse. It was inevitable. I hoped that it wouldn't happen, but it has. So there we go. I don't really know what else to tell you. Just, he was a really good consultant. I feel so lucky and happy. And hopefully the x-rays will show him what he needs to see, and I will be seeing him soon. And I'm also getting a referral to a neurosurgeon from my orthopedic surgeon just for a second opinion, because the medical board can't decide whether I should have surgery or not, because they said in the end the same result's going to happen with or without surgery. So it's not the best news. I don't really want to put my body through further spinal surgery. I've already had surgery done through my neck. The scar's nearly gone. So yeah, so we're having a bit of a battle against the medical board about whether to have surgery or not. I will talk about that all in detail again in another video, because it's a whole separate subject. So that's my quick update. Let me know if you've got elastin loss and if your arches have collapsed. I'm going to be sent to like orthotic clinic, so they're going to make a mold of my foot and give me some special insoles for my shoes. So I'll have very VIP insoles. I hope that they help. Hopefully the pain, it won't be as bad with them. But if you've had anything like that, please let me know below. Share your experiences with me, and let me know how much on the Beighton score you've scored. Is there anyone out there with 9 out of 9? Let me know. The only one that I really can't do is when you bend your thumb like down towards your wrist. That's the furthest I can go, but I can bend my baby finger all the way back, and I can do all the others. So I'm just curious to see what other people experience. So thank you for listening. If you've got any questions, please ask me below, and thank you for watching, and I will speak to you soon. Bye guys.